So in order to understand what are the issues that a gender incongruent child faces, we need to take a look at the normal psychosocial development that a child goes through. Well, as early as 2 to 3 years of age, and we have concrete medical evidence supporting this, the child knows what gender they possess. The confusion is that who do I identify with? And I am looking to the adults who are exhibiting their gender identities to me. I am also looking at the gender roles that are being presented to me by these adults around, who are saying that, look, this is how you need to behave, this is what is expected out of you. And mind you, this is coming from their perception of what the child should be experiencing, based on what they have seen the external genitalia to be, and what the doctor has told them that this is the sex assigned, and hence if in this society a male needs to behave like this or a female needs to behave like this, then that is what is projected. Yes, it is a binary projection. The child now is expected to take their expressions and try to fit into one of the binary silos. As they grow and they exhibit their inner feelings in pretend play, in the choice of clothes, in the choice of toys, to the adults around them, they are observing what is the reaction of the adults. If the narrative is believed and appreciated, then the child is comfortable and the child goes further, exploring other issues. But if the narrative of the child is negated, then the child is, so to say, stuck in this place where they are not clear as to whether their identity, their gender perception is going to be accepted by these adults who are providing care. So what does the child do? It stops exhibiting to these people who do not understand, and it moves into a closet, a space where they are comfortable with what their gender perception is. The danger being that now the primary care providers, the very people who can guide the child as to the rights and wrongs and dangers of behaviors in society, they are excluded. This closeting may start as early as 2 to 3 years. It is preschool age. When the child is going to school and he is looking at this other set of people who their parents view as people who know more, or when the child sees that the teachers are in a position to give the right information, the child tries to exhibit their gender perception to them. And if again the narrative is negated, the child goes into a double closeting. As the child grows further and it grows with its peer groups, here is another opportunity for the child to share their inner feelings. Again, the majority being comfortable in the binary that they have been slipped into, may not confirm or may not affirm the gender expression that this child is exhibiting. And hence, the child goes into a third level of closeting. And this happens in school. This happens when the child needs to be happy, needs to explore, needs to learn. And what have we as adults and peer groups done to this child by negating their narrative is getting them stuck in a place where they are not able to grow forwards. A very dangerous situation. This is exactly what is brought out by this beautiful film, The Mirror, where the mother has mirrored the the joy that the child faces inside, and it happens in a split second, which conveys to the audience that the mother has not gone into medical thesis or taken time to do her research. What she has understood is that if my face mirrors the joy that my child is facing, then this child is going to be happy, and a happy child will definitely be a happy citizen. Uh, yes, once we understand these subtleties, we also understand why it is so important for school teachers, especially primary school teachers, and also the medical fraternity, to know about this trajectory of psychosocial development. Because the parents who are confused are going to ask them, please tell us what is right. And if they are not able to provide the right answers, then this negation will happen. The child will suffer. And that is why it is so important that this film be made a part of the curriculum of teacher training. This film be a part of the curriculum of medical education. This film be shown on the social media. This film should be passed on to all parents and would-be parents too, so that as the child grows up, they learn how, like that mother, to mirror the happiness rather than to mirror doubt, to affirm and understand later rather than take a stern view and try to change what cannot be changed. Yes, gender is hardwired. What I perceive myself to be cannot be changed. What I perceive myself to be, if it matches with the sex that is assigned to me, I am, so to say, congruent. If it does not match, then I am gender incongruent. But even if I am gender incongruent and the providers around me affirm that, look, don't worry, we are very comfortable with how you are, how you see yourself, then this child is not going to get into mental health issues, is not going to get into high-risk behavior, is not going to have decreased life expectancy. And this is what we want. This is what we want, that all forms, all human forms, not necessarily the binary of male and female, but the entire spectrum, be comfortable and be in a position to contribute to our society. Well, isn't that a progressive society? Wouldn't that be what we should be doing? I leave you with this thought.